Welcome back. It's a state of technology that's new to the bluegrass and could help you with your long-term severe joint pain. Joint specialist Dr. Stephen Duncan is here to explain the 30-year knee and what it could mean for you. Dr. Duncan, good to have you with us, sir.
Thanks for having me.
It's our pleasure. So we've got a bit of a game changer here that we were talking about. And let me just use myself for example. Not that I might be a candidate for this, but I am creeping up on 45.
Sure.
And I'm in the Navy Reserve. Do the workouts and all that. And I've noticed as each year goes by, knees are hurting more and more. So I'm moving to cardio and bike and other things to try to keep the impact on the knees. So with a 30-year knee, you used to just hear about people 60, 70 years old being candidates.
Sure.
Well, we're talking about guys my age now, right?
Right. And we want to get you back to doing the things that you want to enjoy. So yes, we'll try to do injections, give you anti-inflammatories, but again, at the end of the day, that only kind of is a buffer as to really fixing the problem.
Right.
So when you've worn out all the cartilage, the old knees would last about 15 years. Well, people in their 40s and 50s, we want to give them one operation so they'll last them the rest of their life.
Exactly.
So with this new type of knee, the oxinium, which is a special type of ceramic metal, it has a better coating on the actual end part of the knee. And so as a result, instead of wearing faster over 15 years, at least in the lab, it's going to last you hopefully 30 years.
Wow. Okay. So this is dramatic. This is a new thing for us. So how can folks find out if they're applicable for something like this? What's the procedure to go through?
So certainly seeing your primary care physician, they can get basic x-rays. If they notice that you've worn out most of the cartilage in their knee, then they can refer them to somebody like myself or other joint specialists who basically specialize in this. And then we can either look at the x-rays or repeat them ourselves and then determine if you actually need the operation. Okay.
Obviously this hasn't been around long enough to truly see the long-term effect, but what are the early results so far? What are you seeing out there?
So far people, at least in terms of the operation, they actually usually go home the next day.
Wow.
And getting back to a normal lifestyle, it's usually about 4 to 6 weeks. If you're really active, maybe sometimes 2 to 3 months. But after that, then people go back. You can run. You can basically do any activity that you want to do.
Incredible. Wow. Now, how can folks learn more about the 30-year knee?
Certainly they can go onto the university's website. The physicians that I work with, we both do the same knee. And then certainly to the Smith & Nephew website to read about it a little bit more.
Excellent. All right. Well, Dr. Duncan, we sure appreciate the information. And as we said, this is a game changer. So it's exciting for your field, too.
Very exciting.
We'll look forward to learning more about this as time moves on.
Sounds good.
Back with more after this. Stick around, please.